Today at On Salus Health, we explain why your glutes and lower back may hurt, as well as look at the most viable treatment options. Buttock and lower back pain is very common and affects a large number of people at different stages of their lives. It can seriously affect a person's quality of life, limiting otherwise effortless daily activities and general movement. It can be acute or chronic and has various causes such as nerve damage, narrowing of the spine, or inflammatory disease, with the potential for hereditary influence. Muscle pain. Pain in the buttocks and lower back can be due to a muscle ailment resulting from overexertion of the lower limbs. It can also occur due to injury to the tendons or muscles located at the back of the thigh. How to treat muscle pain. The doctor will recommend rest as well as placing ice on the site of the injury. They will likely prescribe analgesics to relieve pain and periodic monitoring to evaluate the injury. Bad posture. Pain in the glutes and lower back can be caused by holding ourselves incorrectly. Every part of the body has a corresponding correct posture, but there are many reasons why people develop bad posture habits. An example of this would be craning your head forward to look at a laptop or mobile screen. This can increase tension in the lower back and gluteal muscles. In addition to eye stress and general strain, it can turn into pain. Some activities such as lifting heavy objects can increase the risk of pain in the glutes and lower back. How to treat bad posture. For the treatment of this condition, the doctor will indicate the correction of the posture with the help of a physiotherapist. They will demonstrate exercises to be performed to walk, shift weight, or perform certain physical activities while maintaining correct posture. If you want to learn more about concurrent pain in different areas, our info video above explains back and kidney pain. Sciatic nerve pain. This is a stabbing pain in the affected leg. It begins in the lower back and descends through the buttocks and legs, even reaching the feet. It is caused by the pinching of the sciatic nerve, which affects the lumbar area and can radiate to the buttocks or legs. Sometimes there is a sensation of tingling or stinging, experienced as a kind of whiplash. How to treat sciatic nerve pain. Treatment will be based on physiotherapy, non-steroidal anti-inflammatory drugs, and muscle relaxants. In some cases, spinal injections with corticosteroids or surgery are indicated. The physical therapist will prescribe hot and cold therapy to relieve pain. Pyramidal syndrome. Pyramidal syndrome is a condition that occurs due to compression and inflammation of the sciatic nerve by the piriformis muscle due to its location in the gluteus. It causes muscle spasms and deep pain in both the buttock and leg. This syndrome can cause problems when walking with a feeling of numbness. The pain may increase when sitting or crossing legs. How to treat pyramidal syndrome. The specialist doctor will be in charge. After a medical review, they'll indicate the treatment in addition to a physiotherapist who will perform certain procedures to relieve pain. If this video is helping to answer your questions, remember that you can help our channel to grow with a super thanks. Herniated disc. A herniated disc at the lumbar level can be the cause of glute and lower back pain. It is recognized by a bulging intervertebral disc which causes difficulty moving, walking with pain, and even numbness of the buttocks. This condition can affect the function of the vertebral disc by putting pressure on other spinal structures such as the spinal cord and nerve roots. In addition, it can cause alterations in the functioning of the bladder or intestine. How to treat a herniated disc. The traumatologist, neurologist, and neurosurgeon will be in charge of making the diagnosis and indicating the treatment to follow based on anti-inflammatories and analgesics. This will be accompanied by physiotherapy sessions. In serious cases, surgery is indicated. Bursitis. Bursitis is inflammation of the synovial bursa. The bursa is a small sac that contains fluid located on the bones, muscles, and tendons of joints. Its function is to act as a shock absorber as well as to reduce friction. In cases where this inflammation occurs in the ischiogluteal bursa, it can cause pain in the glutes and back. It can radiate to the legs, causing difficulty sitting or lying down, as well as swelling in the buttock. How to treat bursitis. To treat bursitis in this region, the doctor will recommend rest and placing cold compresses for 15 minutes 2 to 3 times a day. At the same time, they'll suggest taking anti-inflammatories or corticosteroid injections directly into the bursa. Degenerative disc disease. The progressive wear of the intervertebral discs of the spine is known as degenerative disc disease. It can occur in the lumbar region, causing pain in the lower back, producing a tingling sensation and radiating to the glutes and legs. Aging of the body is the most common cause of this condition. This situation causes the intervertebral bodies to lose water, which causes them to become thin and dehydrated. It can appear frequently after 40 years of age. How to treat degenerative disc disease. The specialist will prescribe anti-inflammatories and analgesics, which will contribute to pain relief. In cases where the condition persists, they will often recommend surgical intervention. And that's it for this video from Onsellus Health about the reasons why your glutes and lower back may hurt. If you want to continue learning about other ailments, don't miss the playlist we share here. Like and subscribe for more videos to come, and we'll see you next time.